Hello and welcome to this week's episode of the Her Retirement Podcast. I'm also doing a recording of this episode because I am talking about Medicare, the Medicare maze, navigating Medicare. It is so confusing for so many people. And you know what? I don't blame you. As I started learning myself about Medicare, I had to go back and reread and restudy and really understand what the heck the government is doing with Part A, B, C, D, E, F, G. It's very confusing. If you're preparing to embark on your Medicare journey within the next 12 months, this will certainly be something you want to throw on some headphones and listen to or watch over on my YouTube channel. I'm going to try to simplify Medicare and enrollment. Who is this for? It's for anyone seeking clarity and understanding of Medicare, regardless of age or background, but it's particularly beneficial for those who are ready to apply, getting ready, specifically 64-year-olds who are preparing to enroll in Medicare, and you should definitely start looking into this the sooner the better. And if you're under 65 and living with a disability, what you're going to learn is understanding how Medicare functions and operates, identifying the Medicare plan that aligns with your unique health, budget, and location, determining the optimal plan suited to your needs regardless of financial status, and discovering strategies to avoid errors, penalties, and crucial deadline oversights. So let's get this Medicare party started. There's Part A and Part B of original Medicare. Part A is hospital coverage, Part B is medical coverage. Part A is inclusive coverage for hospital care, including inpatient services, hospice care, and select nursing home care. Part B, medical coverage, is extensive coverage for essential medical services such as doctor visits, lab tests, x-rays, hospital beds, preventative services like colonoscopies, and the ever important mammograms. So let's talk about Part A, hospital. Part A is often mistaken as being free, but it's important to clarify that it is not free of charge. The truth is that you've paid for Medicare Part A through your contributions made via payroll taxes during your working years. If you or your spouse have worked and paid payroll taxes for a minimum of 10 years, you have already fulfilled the payment for Medicare Part A. Individuals who have not worked for a full 10 years or who have not made sufficient payroll tax payments may be required to pay some or all of their expenses associated with Medicare Part A. This can result in expensive costs. Part B, medical. Medicare Part B requires payment, and the amount you pay depends on your earnings. In 2023, the majority of Medicare beneficiaries, over 90%, will pay approximately $165 per month for Medicare Part B. However, if you have a higher income, your monthly payment for Part B may exceed $165. It can range from $200, $300, $400, even surpass $500. The specific amount is determined based on your modified adjusted gross income from 2 years ago. And just as a side note, this premium that you pay, like the extra money you pay if you're over a higher income, is called IRMA, the Income Related Monthly Adjustment Amount. It is a premium that you pay, a penalty, if you will, for having a higher income. It's based on your modified adjusted gross income. So there are some strategies you can use to lower your modified adjusted gross income, thereby lowering your Medicare Part B premium, or IRMA. I have an entire webinar on IRMA, and I've talked about it in my podcast. If you would like access to that IRMA because you are potentially in that higher income bracket, definitely reach out to me at lynnt@herretirement.com, and you can access that IRMA on demand webinar. So very important to understand some very unique strategies to lower your modified adjusted gross income, to lower these expenses. And of course, there's other benefits for lowering your income in retirement because you're going to pay less taxes. So it's all part of a tax planning strategy. Now, the payment you make is based on income, as I said, but it can catch some individuals off guard. It's called the blind spot, and that's one of the things we do at Her Retirement, is to help you avoid these blind spots. It's crucial to be aware that your monthly Medicare Part B premium may not align with what others are paying. It's determined by your income from 2 years ago. It's a 2-year look back. Some individuals with low income do receive assistance from their state to cover the costs of Medicare Part B. The vast majority of people, as I said, pay $165 per month. There's also a deductible of $226 per year. Now, if you receive Social Security benefits, the monthly premium for Medicare Part B is automatically deducted from your Social Security payments. For those not receiving Social Security benefits, the payment process is slightly more complex. When relying solely on government Medicare, you are responsible also for paying 20% of all Medicare Part B costs. These are out-of-pocket costs. The government covers the remaining 80%, which may initially seem favorable. However, it's essential to recognize that the 20% you are responsible for is not capped. This means that for every significant medical expense, your out-of-pocket liability could potentially amount to thousands or even hundreds of thousands of dollars. While it's not my intention to alarm you, it's critical to acknowledge that government Medicare alone may not provide you with sufficient coverage, okay? Very, very important. It can also leave you with gaps and limitations within that government Medicare program that can leave you exposed. So you really want to make sure you understand these gaps, understand your health situation, and figure out how to pay for those out-of-pocket costs. You know, I think the research says that statistics say that it could be $150,000 in out-of-pocket costs over the course of a retirement for an individual. For women, it's slightly higher because we live longer. So out-of-pocket costs is no joke. It's another blind spot. It's another expense that people woefully underestimate. It's highly recommended that you explore what's called supplemental coverage options to fill the gaps in government Medicare and protect yourself from these financial burdens. All right, next thing that I want to cover is Medicare coverage limitations. What is not covered? You need to understand that. The significant gap in original Medicare A and B lies not only in the 20% patient responsibility for Part B services, that's for things like chemotherapy, radiation, or dialysis, and of course these costs can quickly escalate due to the frequency or duration of these treatments. But original Medicare and A and B do not provide coverage for prescription drugs, and we know Americans spend a ton of money on prescription drugs. To address this gap, you need to purchase a separate private insurance plan known as Medicare Part D, which offers prescription drug coverage. However, even with Medicare Part B, you will still need to pay 20% of the cost for certain drugs, which are typically expensive medication like those used for rheumatoid arthritis, osteoporosis, and chemotherapy. Original Medicare A and B do not cover dental services, including cleanings, exams, and x-rays. No dental coverage is provided at all. While original A and B can cover certain vision conditions like cataracts, macular degeneration, and glaucoma, it does not cover routine eye exams. These exams are essential for detecting eye conditions in their early stages because, of course, left unchecked could lead to major issues and major expenses. Of course, you always want to get things checked. The earlier, the better. Medicare A and B do not cover hearing services like hearing exams, the cost of hearing aids, and of course, hearing aids can be expensive, and Medicare does not provide any assistance in that area. And Medicare does not cover any cosmetic procedures like to get rid of our wrinkles, to get Botox, to get rid of excess fat, and other services considered medically unnecessary. So what are some options to fill Medicare coverage gaps? Well, it's crucial to acknowledge the limitations and understand them so that you can opt for supplemental coverage to fill the gaps. You know, this is part of what my platform, Her Retirement, is all about. It's about identifying the gaps and how you can fill them, and Medicare is no exceptions. You need to be prepared. You need to know more to have more. There are various options available to supplemental government Medicare, providing comprehensive coverage. Generally, you face a choice between two paths. One option is to purchase a Medicare supplement plan, also known as Medigap or supplemental plan, which works alongside government Medicare. The other option is to explore private Medicare, referred to as Medicare Advantage, PPOs, or HMOs. Selecting the right path is a critical decision that may have long-term implications. It's essential to carefully consider your options, as this could be a lifetime decision with limited options for changing later on. So let's talk about option 1, Medicare supplements. This plan serves as an additional layer of coverage alongside your existing original Medicare. Essentially, you retain your enrollment in government Medicare Parts A and B while obtaining a private insurance plan to address the gaps in coverage. By acquiring a private insurance plan, you ensure comprehensive coverage that complements and enhances your existing original Medicare benefits. Let's talk about the benefits of Medicare supplements. The first is unrestricted healthcare access. The most significant advantage is the freedom to choose any doctor and hospital across the nation. This is unparalleled flexibility. It's highly appealing to individuals seeking comprehensive healthcare options. Number 2 is enhanced financial security. Medicare supplements fill the gaps in the original Medicare, mitigating the high risk of out-of-pocket expenses. By providing additional coverage, these plans offer greater flexibility and a clearer understanding of your healthcare costs. Number 3, simplified and standardized coverage. In a noteworthy development, Medicare supplements underwent standardization. This means that regardless of the insurance provider, a specific plan, such as Plan G, offers identical coverage. This shift from the previously complex and confusing system ensures transparency and prevents any deceptive practices. And we have 4, which is guarantee of benefits. Once you select a Medicare supplement plan, your benefits remain unchanged. As long as you continue paying your monthly premium, your coverage will remain intact. This guarantee allows for lifelong plan renewal and safeguards against unexpected modifications. And number 5, a separate prescription drug coverage. It's important to note that if you opt for a Medicare supplement plan, you need to obtain a separate prescription drug plan. This ensures comprehensive coverage for both medical and prescription needs. Okay, so Medicare supplements, eligibility, and enrollment. Your health must qualify. You're going to be asked numerous health questions by different companies to understand your health status in the last 2 to 5 years. Questions do vary slightly, covering conditions like cancer, heart attack, COPD, rheumatoid arthritis, stroke, and more. Answering yes to these questions can often make you ineligible for a Medicare supplement. So during initial enrollment, when enrolling in Medicare Part B, insurance companies must accept you, okay? During this enrollment period, health questions are not allowed. Any plan shown on any chart that shows you the different supplement options is available for selection. So there's an important enrollment window. Missing that initial enrollment window leads to health-related questions, okay? So if you miss it, you're going to be subject to the questions. Answering yes to these questions may permanently disqualify you from Medicare supplements. So you need to understand this before you start this process. And there's really 2 popular plan choices. Plan G and Plan N are commonly preferred by individuals as they provide comprehensive coverage for Medicare gaps. And if you met with a Medicare specialist that we can connect you with, they would go over all these plan choices. But Plan G and Plan N are commonly preferred, and they could go over all the reasons for that. We don't have time in this episode to go into that. You know, it's important to note that proper understanding of eligibility, enrollment windows, and plan options is essential when considering Medicare supplements, and it's wise to seek the guidance of a Medicare expert. We offer a couple different types of experts, ones that are consulting based, where you just pay a flat fee and they consult with you. They really dig into the details of everything that you might need health-wise, drug-wise, and to match you with the best Medicare plans and supplement plans, gap coverage. Or you can work more with a Medicare insurance agent who is compensated through the plans that they are selling. Again, they do the best they can to match you with the right services. They're just compensated through the insurance companies versus you paying for a consultant. Just, it's really up to you which way you would like to go. Okay, option 2, Medicare Advantage. It combines Medicare Parts A and B, supplement, and drug plan into one package. Let's talk about the benefits of Medicare Advantage. While it may have a low premium or no premium, it's important to note that you will still need to pay for Medicare Part B. Enrollment in Medicare A and B is necessary to be eligible for Part C. Unlike Medicare supplements, Medicare Advantage operates within a network of doctors and hospitals. The size of the network varies, but it's typically including all of your preferred healthcare providers. Medicare Advantage plans often include coverage for prescription drugs, Part D, within the health plan. Premiums can change annually, unlike Medicare supplements that remain stable, and it's important to be adaptable and open to potential changes each year. Also, plans may differ for individuals living in different areas. So what are some of the extra benefits of Medicare Advantage as of 2023? Dental coverage, which may include routine dental care, cleanings, fillings, and even dentures. Vision coverage, eye exams, prescription eyewear, glasses, contact lenses, and discounts on vision-related services. Hearing aid coverage. Transportation options may include rides to doctor's appointments, pharmacies, and other healthcare facilities. Meal assistance may include meal cards or reimbursements for specific dietary needs, such as post-surgery recovery. It's important to understand that not all Medicare Advantage plans offer the same extra benefits. Availability of benefits can vary by county within your state, so it's crucial to research plans specific to your location. Extra benefits may change annually, so staying informed about the current offerings is essential. Remember that original Medicare does not include most of these additional benefits. And of course, Her Retirement can assist in researching these available insurance companies and benefits specific to your zip code. So, supplement or advantage. Choosing between Medicare Supplement and Medicare Advantage depends on several factors, including budget, health condition, your travel frequency, number of doctors, and your comfort level with change. Medicare Supplement is advantageous for individuals with a higher budget, offering flexibility and nationwide coverage. Medicare Advantage may be more suitable for those who are healthy and infrequently visit doctors, as well as those with ongoing health conditions that require more comprehensive coverage. Travelers and individuals with multiple doctors may benefit more from a Medicare Supplement plan to ensure broader access to healthcare providers. Personal preferences, family medical history, and anticipated health needs should be considered when making this decision. And you can regularly reassess your health and financial situation to ensure the chosen plan continues to meet your needs. So if you want to start with one and switch to the other, which plan should you start with? Supplement to Advantage or Advantage to Supplement? Everyone's situation is certainly unique, and the best Medicare plan for you may differ from others. Evaluate your health, your budget, your insurance preferences, and your travel frequency. Medicare Supplement is available to everyone during the initial enrollment period for Medicare Part B. Regardless of your health, insurance companies must accept you in any state and plan. Starting with a Medicare Supplement provides flexibility and the ability to choose any doctor or hospital. If you can comfortably afford a Medicare Supplement plan, it's recommended that you start with it. Keeping in mind that Medicare Supplement premiums typically increase annually around 5 to 10%. After a few years, the premium may become less affordable, but you can explore other options. Private Medicare Advantage plans can be an alternative with zero or low monthly costs. Medicare Advantage plans offer extra benefits such as gym memberships or grocery cards. You have an annual opportunity to switch to Medicare Advantage during the open enrollment period, October 15th to December 7th. If you initially choose Medicare Advantage, you can switch back to Medicare Supplement in the future. Moving between plans based on your changing health and financial circumstances is an option. Consider your age, health outlook, and preferences when making these transitions. So a little caution when choosing your plan. It's vital to assess your healthcare needs, preferences, and budget when selecting a Medicare plan. Relying on someone else's plan without considering your own unique circumstances may lead to inadequate coverage. Your health condition, prescription meds, providers should drive your plan selection. Ensure the plan you choose covers your doctors, hospitals, and necessary medications. Medicare plan availability and coverage options vary by zip code. Your location plays a significant role in determining the plans accessible to you. Of course, consulting with a Medicare specialist or insurance professional can help you navigate the huge range of options, and they can assist in assessing your specific needs and finding a plan that best aligns with you. Critical deadlines and penalties. Retirees have a 3-month window before and after their 61st birthday month to enroll in Medicare without penalty. On the other hand, working individuals with employer coverage are not penalized for keeping their current plan. Missing enrollment deadlines can result in lifelong penalties, such as the Part B and Part D penalties. The Part B penalty is 10% of the monthly premium, increasing annually, while the Part D penalty can also apply. It's essential to compare the benefits of Medicare to your employer coverage if you're still working at 65, as Medicare may provide more advantageous options. You need to make an informed decision by evaluating the advantages and potential cost savings of Medicare versus your employer's plan. We can connect you with these resources to help you analyze these plans and make the best decision. And I also have a more in-depth Medicare class that's part of my HER Retirement Roadmap Masterclass. The Masterclass includes class workbooks, guides, checklists, decision trees, and other resources. If you want to learn more about the Masterclass, go to herretirementclass.com. Module number 6 in the Masterclass covers healthcare, Medicare, and long-term care. I will do a future podcast on long-term care as well as estate planning. So in that Masterclass, there's 8 modules, and the 6th module is the one that covers healthcare, Medicare, and long-term care. The point of today's podcast and video was to give you a very high-level overview of the Medicare options that you have. There's also some changes coming to Medicare, which you can learn about in the Masterclass, important changes that you need to be aware of. One of the other things that I wanted to point out today is that Medicare comes out of your Social Security benefit. One of the issues is as we age, our Medicare costs, medical costs go up. So potentially, like a 65-year-old couple, by the time they reach 80, most of their Social Security benefit could be going toward Medicare medical expenses. So it's really important to understand how your Medicare and medical costs will impact your retirement income. And relying on Social Security for your income alone is not a good decision. For most people, Social Security accounts for 30 to 50% of their income, and you may say, okay, my Social Security will be my medical expense, right? That income will just cover my medical expenses, and if there's any left over, then that's a bonus. But then you have to have your other income sources, which of course, if you have deferred retirement savings accounts like 401ks and IRAs, if you have Roth accounts, Index Universal Life, you're going to work, maybe you get inheritance, rental properties. I mean, all of these income sources go into creating your retirement paycheck, and it's very important to understand how these costs will impact you. The other thing that we didn't talk about was out-of-pocket costs. So in this session, we talked about Medicare and medical supplement costs. So out-of-pocket costs can add up to a very large number over the course of retirement, and you need to be prepared for those. And so in the Masterclass, I talk about ways to fund those out-of-pocket costs and to fund things like long-term care, because again, in the Masterclass, you'll learn that Medicare does not pay for long-term care. That is a completely separate expense that is on you. So I hope you've learned a little bit about Medicare, and you are welcome to reach out to me if you need help. You're 64 and you're needing to make a decision pretty soon here. You need to start evaluating your options and trying to decide the best situation for you. What is the best plan for you beyond parts A and part B? Definitely reach out to me at lynnt@herretirement.com and go to herretirementclass.com if you would like to access the 8 modules in that masterclass, one of them being on Medicare, healthcare, and long-term care. Here's to knowing more, having more, and getting her done.